Every year, during the warmer months, a dastardly, blood-sucking parasite rises from the earth, intent on feeding. Carrying diseases, such as Lyme disease, Rocky Mountain spotted fever and ehrlichiosis, these skin-burrowing atrocities range in size, from a poppy seed in youth to a sunflower seed in adulthood. No state is free from this scourge, and when wet weather is met with warmer winters, the mice population grows, as do the ticks who feast on their blood. A green pasture of grass looks inviting. A nice stroll in the woods seems like a pleasant way to spend an afternoon. And both of these thoughts are true, but there is a hazard that should be considered when working in such areas or enjoying these pastimes. This is the habitat of the tick. They live in grassy, bushy or wooded areas and even on animals. They are found everywhere outside of highly urbanized areas, even in your backyard or neighborhood. The most effective method for preventing exposure is to stay out of the tick's habitat, but that is not feasible due to work requirements or lifestyle choices. Managing the risk can be done by avoiding wooded and brushy areas with high grass and leaf litter. Remain on trails whenever possible while walking in the middle of the path. Wear long sleeves and pants that are light in color with no holes or mesh. Seal your seams to prevent entry into any gaps. A common way, albeit a poor style choice, is to tuck your pant legs into your socks. Treat your clothes and gear with an EPA-registered insect repellent, such as DEET or picaridin. Apply repellents that are rated for ticks on your exposed skin, as well. If you are in their habitat, sometimes they get you, and it is important to remove them as soon as possible and save them so your doctor can test for Lyme disease. Use a fine-tipped tweezer to grasp the tick as close to the skin surface as possible. Contrary to popular belief, avoid using nail polish, petroleum jelly, or heat to make the tick detach from the skin. Pull upward with a steady, even pressure. Do not twist or jerk the tick, as this can cause the head of the tick to break off and remain in the skin. If this occurs and you are unable to remove the head easily, leave it alone and let the skin heal. After removing the tick, thoroughly clean the bite area and your hands with rubbing alcohol, an iodine scrub, or soap and water. Most tick exposures only leave you with a little less blood, but exposure to a disease-carrying tick can lead to an illness. It is important to seek medical treatment if symptoms present themselves after a tick bite. A common symptom for any tick-borne disease is fever and chills. Also, tick-borne diseases can cause headache, fatigue, and muscle aches. People with Lyme disease may also have joint pain. Another symptom is a skin rash. Lyme disease, southern tick-associated rash illness, Rocky Mountain spotted fever, ehrlichiosis, and tularemia can cause distinctive rashes. If any of these symptoms appear post-exposure, seek immediate medical attention.
Now go work and enjoy nature with awareness.